Is Elizabeth no.
Welcome back. The last session of the workshop addresses the use of population dynamic models to understand the population health effects of ends, and so those models offer a framework to understand data gaps and uncertainty. So how we are organized the session, there's going to be a speaker followed by a discussion from a distinguished panel of experts in computational models. Right now I'm going to introduce Dr. Eric Vugrin. He's a distinguished member of the technical staff at Sandia National Laboratories. His primary research interest is the development of modeling and analysis tools for complex systems, especially critical infrastructure. He has been the principal investigator on numerous research projects that have been technical, operational, and strategic guidance to programs in several federal agencies. Dr. Vugrin.
Thank you. And thank you for the opportunity to speak and participate with this distinguished panel. So at the end of the day, we have the opportunity to look back and see kind of what's been discussed. And it's been incredible to see. We've been at the cellular, at the molecular level, and now I'm going to go to the opposite extreme. So we're going to talk about population health models, where we're frequently looking at kind of the national or at least regional level for projecting potential health impacts. So when we talk about a population dynamic model, we're talking about developing numerical, mathematical models we can implement in software and then project out into the future what the potential health impacts might be. So this is work that I've done with my colleagues at Sandia National Laboratories in Albuquerque, New Mexico, and then it's also been a partnership with staff from the Center for Tobacco Products at the FDA. So first, I'll tell you kind of where we're going to go in this discussion. I'm going to talk about motivation. And today, it's not hard to talk about why we would think about modeling multiple tobacco products instead of just cigarettes. But when we started this effort about 7-8 years ago, there was questions. Shouldn't we just focus on cigarettes? But today, it's much less of a difficult argument to make. So we're going to talk about our motivation for developing the models. As much as I would love to get into mathematical details of the modeling components, I've been told don't put equations up there. Not everybody geeks out the same way I do about the math. But I'll give you a high-level overview of the model components, how we go about exercising it, what are some of the results that we might be able to get out of it. Illustrative results. I'm not going to show anything for a particular specific product, whether it's ends or something else. I'm just going to show some illustrative results to demonstrate conclusions that we could hypothetically make. And then if we're going to use this type of modeling approach to explore potential health impacts and benefits of ends at a population level, I'll conclude with talking about what would we need from a data perspective to do that. So the last 5 to 10 years, there's been a lot of changes in the tobacco policy and product space. So we've had the Family Smoking Prevention and Tobacco Control Act stood up in the United States. Domestically and abroad, there's been talk about a lot of potential policies implementation in some different places. And so one of the things that we were asked to do and why FDA first approached us was to help develop a set of computational numerical models that could be used to understand what would the potential impacts be of policy changes to cigarettes. And one of the interesting things about policy and populations is it's not necessarily described by a system of physical differential equations. People are going to make changes. They're going to adapt. And if you affect the availability or use of cigarettes, they might quit, they might continue, or they might find different products. And so about 7 or 8 years ago, there were kind of the first rumblings with electronic cigarettes at a national level, but there were certainly other products out there. Smokeless tobacco, snus was coming over from the Scandinavian countries and being considered. And so what we discussed with the Center for Tobacco Products in formulating the models was historically we recognize population health models have focused on cigarettes almost exclusively. because they were the vast majority of products used in the marketplace, and you could do a reasonable estimation projecting into the future by focusing on them. But with the introduction of newer products and changes in policy, you want to make sure that you have the tools to explore options and changes. And so that's why we started developing population dynamic models that considered not just cigarettes, but other tobacco products as well. So we tried to do what good modelers are supposed to do and not build a model and then figure out what questions it's good for. We tried to figure out ahead of time what were the specific questions that we wanted to address and support from an analytical perspective, because depending on those questions you're trying to address, you'll build a different model. And so in this particular case, there were two sets of scenarios that we wanted to be able to consider. The first was the status quo scenario. So what if the products available remained the same? What if general usage of those products remained the same as far as initiation, cessation rates? What would the future possibly look like at a national scale? So that was one scenario that we were looking at. And then the more interesting one is the what if scenarios. What if a new policy was enacted? What would the potential impacts be on population health at a national scale? What if new products entered the market? What if both of these happened? There's a lot of complex pieces that once you start putting them together, a computational tool can help explore that space. And so what we wanted to be able to do was a number of things with those various scenarios, to do some comparisons between the status quo and a what-if scenario, but also between various what-if scenarios. What if policy A is implemented or policy B? What if new products came out with one particular set of characteristics or attributes as opposed to a different characteristic or set of attributes? So we wanted to be able to compare between those. We also wanted to show the range of possible outcomes. This is uncharted territory. It's very difficult to run a national level experiment where you implement a new policy and they say, never mind, we were just gathering data. So we want to be able to project out in the future. We recognize that you can't nail it down with one single point estimate. So we wanted to understand what were the uncertainties within the modeling approach and what would those uncertainties be as far as affecting the outcomes. And so we wanted to show the range of possible outcomes. And finally, population dynamics is the term that Dr. Mendez used. We wanted to see how things would progress over time. Sometimes the impacts are not realized immediately. When a 15-year-old starts smoking, it's really not until decades later that they're at an elevated mortality risk. And so as we talk about new products and new policies, it takes time for potential impacts to work throughout the system. And so we don't want to just look 6 days, 6 weeks into the future, maybe 6 years, maybe 6 decades, and figure out how things might change over time. And so when we talk about population health impact, there were a variety of different measures. The two that we frequently think of are prevalence, so the number of people using a particular product, and it could be current users, never users, former users. Those are things that we would like to be able to track. Mortality is another one that we typically look at. What are the number of people dying in particular scenarios? Some people talk about premature deaths, but we wanted to do kind of comparisons between scenarios to look at mortality. For the purposes of this discussion, mortality will be meaning all-cause mortality, but you can certainly talk about cause-specific mortality as well. So I mentioned there were previous population dynamic models looking at cigarettes, and a lot of good work was done. Drs. Mendez and Dr. Levy certainly did incredible groundbreaking modeling work. And our work to look at multiple products really springboarded off of the work that they had done. So at a high level, it's very similar to the major pieces that they had. And so we have a model that's going to step forward in time. We start out with a population, heterogeneous population, in which individuals vary by state. And when I say state, I mean state is a unique combination of age, sex, and tobacco usage. So if we're talking about traditional cigarettes and electronic cigarettes, one state could be 15-year-old females who have never used either product. Another could be 35-year-old males who previously smoked but now are current electronic cigarette users. And then it could be 85-year-old women who were former users of each. So those are a couple examples. But we start out with a population where we know the number of people in each of those state groups at a particular time. And we're going to step forward in discrete time steps. And in between the first time step and the next time step, there are changes that can happen within the population. The two key changes are changes in tobacco usage. So things like cessation, initiation cessation. It could be switching from one product to another. It could be relapse. And so to model that, we use a Markov model of state transition. And so what we assume is the probability that somebody changes from one tobacco use state to another in that time step is determined by their state at the first time step. So if you are a female non-smoker, non-e-cigarette user, 15-year-olds, you're going to have one probability of transitioning to a different state as opposed to perhaps a 35-year-old male at a different usage state. So we have individuals who they have a probability of changing from one use state to another, and then we also have a Markov formulation for the probability of dying. Everybody has a base probability of death. That's determined by kind of never use. And then there's this a relative risk probability where if you're using tobacco or we're currently a tobacco product user, there's a multiplicative factor on that base probability of death. And so at each time step, there's a probability that you die, whether you're a tobacco user or not. It's just what is the exact value will be determined by your state as well. So we have the Markov model of state transition. That's going to change the number of people in the population. It's going to change the makeup. We also have births going on. We have net international migration. All of this happens in between time steps. So at time step 1, we start with an initial population, and we're going to track it over time how the changes happen. So the interesting part about this model and where we started to expand upon previous approaches really comes down to the tobacco use transitions. So within the modeling context, we can talk about one product or 2, 3, 4, however many we need to. But let's start talking about one for the tobacco use transitions and see how it varies when we go from just talking about cigarettes to adding more products in there. When we talk about just one product, what we have here is 3 tobacco use states: never, current, and former users. And so there are 3 transitions that we track: initiation from never to current, cessation from current to former, and relapse from former to current. 3 product use states, 3 transitions when we're talking about one product. When we go to 2, I don't even have to tell you the numbers there, but you can see it's a lot more messier and a lot more complicated. This is where a model helps us keep track of everything. Now we've got 9 tobacco use combinations: never, current, former for cigarettes, never, current, former for electronic cigarettes, and every combination of those. And we've got 27 transitions. So if we start with never, never user, they can go this pathway and just pick up cigarettes within one time step, or they can go this pathway and just pick up electronic cigarettes, or they can pick up both within one time step. So now initiation, there's 3 probabilities just for that. And so when we're talking about the data and the tools that we're using, the complexity is going to grow rapidly as we go from just one product to 2 products. They won't let me show 3 products because it's just too messy. So what are the types of inputs that we need for this model? First is the initial population. How many people are in each of our state categories at time 0? We need migration rates, birth rates, death rates for never users. We need relative risks for mortality. We also need the transition probabilities that I talked about before: initiation, switching, cessation, relapse. But now we can't just have that information for cigarettes, and we can't just have that information for electronic cigarettes. We need to have all of the parameters specified by our state groups: sex, age, and multi-product use state, where it's a never, never, never current, et cetera. So if we have that information, we can run the models and we can get estimates of prevalence, mortality, life years lived, and other statistics. And we can report that information at an aggregate level, or we can also scale down by the individual states as well. So Here's a hypothetical example. Don't assume that this represents any specific products here. We just, for the purposes of showing you some of the results that we can get, I've got an image here. On the horizontal axis, we've got time. We start in 2000 and we go to 2050. And on the vertical axis, we've got a measure of mortality. So this blue line down the middle is the status quo scenario. So we're measuring everything relative to the status quo scenario. And if we go below that line, that means we've got fewer deaths in the scenario. And if we're above that line, we've got more deaths in these hypothetical future scenarios. So in this hypothetical scenario, we assume there's some new product that comes out. It's assumed to be lower risk. And in this case, that means its excess relative risk is a quarter of what cigarettes is. And so what we wanted to do was to see what the impacts would be in a number of different scenarios and on some of the subpopulations. So this red one down here, right here, what we're doing is we're assuming that the only changes that are happening relative to the status quo is you have current smokers who are either switching or they're picking up both. They're poly users, or they're switching and then quitting that. There's a variety of different aspects here. And when we see that, when we focus only on that subpopulation, we see if we start a change in 2003, we get a pretty rapid drop-off. And so in this particular case, there would be a net benefit to the current smoker population if this product was introduced. But it's not just the current smokers. There are other populations that might be using it too. So up top, we have a set of assumptions for how would it affect never smokers. And so this could be a never smoker who picks up this new product but never would have smoked otherwise, or maybe they pick up the new product and then they switch to traditional cigarettes, or a variety of different scenarios here. So to focus on what's the impact of just the never smokers, we set a number of assumptions there. And what we end up seeing here is that for a couple of decades, there's no impact. And that's because it takes time, when we're measuring mortality as our population health impact, it takes time for the risks to be realized. But just on that population alone, there would be a negative impact. And when we combine it into one kind of overarching impact here, this is one overarching scenario, the purple scenario, that's where we put the assumptions related to current smokers and the assumptions related to never smokers. And we see that things are changing over time. And so when we use models to support analytics, one of the key questions that we have to ask ourselves is, if we're measuring impact, at what time frame are we looking to measure impact? Things are going to change. This is a dynamic system, and things are always moving along. So just an example scenario, not any real products intended to be shown here. This here is a deterministic simulation, but a set of different bounding scenarios. What we have is then we can do sensitivity analysis. So we can do single parameter sweeps where we change one variable and move that over a variety of ranges. We can do multivariate analysis. We can do sensitivity analysis. That's all of the great things that a computational model will allow you to do. I'm not going to get into the details here, but we can do that kind of thing. So the question is, we have these models. Is there some potential applicability to analyzing ends? And so the first thing I'd state is, this is uncharted territory. New products, we're thinking about policies that haven't previously been acted, and we would be remiss if we decided to make decisions based on historical data alone. We need to use modeling in a smart, informed way and understand what are the potential benefits and detriments. Secondly, we have the opportunity to explore a lot of what-if scenarios. So there's a lot of questions being thrown out there, a lot of assumptions. There are going to be gateway drugs. There are going to be cessation aids. I don't know what the ultimate truth is going to be, but until we have that data, we can use models to explore those potential impacts and what would the effects be if they were effective smoking cessation, or if we had people who never would have picked up cigarettes in the first place starting to smoke them. Not only can we explore them, we can look at the impacts of uncertainties. And a lot of times we think data gets collected for models, but models can be used to help determine what data we should be gathering. Sensitivity analysis can tell us what are the key parameters that we need to further understand to do better projections. And lastly, even if we don't know what the future conditions are, we can do tipping point analysis. We can understand under what conditions might we end up with a better scenario or a worse scenario. So data needs that we would want for this type of model is better characterization of transition parameters. So some of them are the same, initiation, cessation, relapse. But when you're talking about multiple products, switching comes into play. Polyuse is another factor. And we need to think about previous assumptions that we had for traditional cigarettes, and do those continue to hold? In many cases, I would suspect not. We need relative risk parameters in terms of mortality, that this is for all cause and disease specific. But we don't just want to understand relative risks for just end users. We need end users. We need to know for current users. We need to know for polyuse, people who are using both. We need to know for switchers. There's a variety of different categories in which we'd want to understand what the relative risks are from a modeling perspective. So what I'll finish off with is that as we move into this space to explore ends through models, and we're talking about data collection, it's not good enough to collect cigarette information and then to collect ends information without having a cohesive understanding of how they interplay. It's very difficult to stitch them together if you only have cigarette information and ends information into this multi-product formulation. What we want to do is we want to start asking the questions where we're considering those both at the same time. And so with that, I'll just mention my collaborators. And this work was done in collaboration with the FDA, but whatever I say is not their perspective, it's my opinions. So, thank you.